3 shocking signs your body might be hiding a serious illness. Don't ignore these. Your body is more than a machine. It's your most loyal messenger. But here's the catch. When something's wrong, it doesn't always scream in pain. Sometimes, it whispers in ways we brush off as normal. These quiet clues might seem harmless, but they can actually be red flags for serious, even life-threatening conditions. If you've been feeling off lately, your body might be trying to tell you something, and you can't afford to miss the message. Let's start with an easily overlooked sign: unintentional weight loss. If you've shed more than 10 pounds without changing your diet or workout routine, don't celebrate just yet. Dr. Richard Wender, Chief Cancer Control Officer at the American Cancer Society, warns that sudden weight loss can signal cancers like pancreatic, esophageal, stomach, or lung. It might also point to diabetes, thyroid dysfunction, or digestive disorders, all of which need immediate attention. Next up, your teeth. If your dentist notices enamel erosion, especially on your back teeth, it could mean more than bad brushing habits. You might have acid reflux, a condition where stomach acid sneaks up into your throat and mouth. Many people have it without even feeling heartburn, yet it can lead to esophageal cancer if untreated. If you regularly taste sour acid, cough at night, or feel a burning sensation, see a gastroenterologist. And what about that stubborn rash? If you have an itchy, blistering skin rash that won't go away with creams, it could be dermatitis herpetiformis, a skin manifestation of celiac disease. That means your body is reacting to gluten by damaging your small intestine. Even without digestive symptoms, this rash might be your only clue. Don't wait. Your health depends on listening to the whispers. Continuing with the subtle signals your body might be using to alert you, let's take a closer look at some more signs you should never ignore, because they might just save your life. That itchy, blistery skin rash we mentioned earlier? It's not always a simple allergic reaction. Known as dermatitis herpetiformis, this rash is triggered by antibodies that collect beneath the skin. Shockingly, about 1 in 4 people with celiac disease develop this rash, often with no digestive symptoms at all. That's what makes it so deceptive. The only proven treatment? A strict, lifelong gluten-free diet. If you've had recurring rashes that resist treatment, get tested for celiac disease. Your gut and skin might be under silent attack. Next, consider this alarming symptom: a tearing sensation in your back. If this happens out of nowhere, without injury or exertion, it could signal an aortic dissection, a medical emergency. This occurs when the inner layer of the aorta, your body's main artery, tears, allowing blood to split the layers of the artery wall. It can lead to deadly internal bleeding or cut off blood supply to critical organs. Symptoms may include intense chest or back pain, shortness of breath, sweating, or even stroke-like signs. Don't wait. Call emergency services immediately if this occurs. Now on to something smaller, literally. Has your handwriting changed? If it's becoming cramped, shaky, or unusually tiny, you could be seeing the early signs of Parkinson's disease. Parkinson's affects muscle control and coordination, with symptoms like tremors, stiffness, and slowed movement often starting subtly. Micrographia, or shrinking handwriting, is one of the first signs. Finally, let's talk snoring. While it may seem harmless or just annoying, loud snoring, especially with gasping, could mean sleep apnea. This sleep disorder disrupts your breathing and can increase risks for heart disease, stroke, and more. If you're always tired despite sleeping, talk to your doctor about a sleep study. First up, if you've noticed a yellowish tint in your eyes or skin, that's a major red flag. This condition, known as jaundice, is caused by a buildup of bilirubin, a yellow pigment produced when red blood cells break down. Normally, your liver filters bilirubin out, but when something's wrong, like hepatitis, cirrhosis, or even liver cancer, bilirubin can accumulate, turning your skin and eyes yellow. Other potential causes include gallstones, hemolytic anemia, or pancreatic cancer. Jaundice is your body's way of saying your liver may be in trouble, so don't delay seeking medical attention if this symptom appears. Another overlooked warning sign is swelling in your feet or ankles. While it might just be from standing too long or indulging in salty foods, it can also point to something much more serious. Persistent or painful swelling can signal fluid retention or edema, often linked to heart failure, kidney disease, or liver problems. Blood clots can also cause this kind of swelling and require immediate medical care. If you experience swelling that doesn't subside, especially if accompanied by shortness of breath, chest pain, or sudden weight gain, consult your doctor without delay. Lastly, frequent urination may seem like a minor inconvenience, but it could be an early sign of diabetes. Elevated blood sugar levels force your kidneys to work overtime, causing you to feel thirsty and run to the bathroom more often. Other common signs of diabetes include fatigue, blurry vision, numbness in your hands or feet, and slow wound healing. If you're noticing any combination of these symptoms, it's crucial to get tested and start treatment early. Continuing with the subtle yet serious health warnings your body might be sending, here are a few more that should never be taken lightly. If you have moles on your skin, they might seem harmless, but they require regular monitoring. Pay close attention to any changes in their size, shape, color, or texture. These alterations could be early indicators of melanoma, the deadliest form of skin cancer. Melanoma can spread quickly to other organs if not caught early. It often begins as a mole that looks a little different from the rest or starts evolving in appearance. If you notice any such changes, consult a dermatologist promptly. Early detection can make a significant difference in treatment outcomes. Another symptom that warrants immediate attention is difficulty swallowing, also known as dysphagia. While it can be caused by aging or neurological issues like stroke, it may also be a red flag for more serious conditions such as esophageal, throat, or thyroid cancer. If swallowing feels uncomfortable or painful, or if you experience coughing, drooling, or unexplained weight loss alongside it, don't ignore it. Persistent dysphagia should be evaluated by a medical professional to rule out serious conditions. Finally, a persistent cough that lasts longer than 3 weeks is more than just an annoyance. While it could stem from common infections like bronchitis or pneumonia, it can also be a symptom of lung cancer, the world's leading cause of cancer-related deaths. The danger with lung cancer is that it often doesn't present symptoms until it's advanced. Along with a chronic cough, be aware of chest pain, wheezing, hoarseness, coughing up blood, or unintentional weight loss. If over-the-counter remedies aren't helping and the cough lingers, it's crucial to seek a doctor's evaluation. Your lungs could be trying to tell you something urgent. Wrapping up this important list of hidden warning signs from your body, let's talk about one that many people overlook: changes in your bowel habits. While occasional irregularities might not be serious, persistent changes could be your body trying to tell you something critical. If you notice ongoing constipation, diarrhea, blood in your stool, or any shift in the color, shape, or consistency of your bowel movements, it may indicate an underlying digestive disorder. Conditions like irritable bowel syndrome (IBS), inflammatory bowel disease (IBD), diverticulitis, hemorrhoids, or anal fissures are commonly linked with such symptoms. However, more alarmingly, these signs can also point to colorectal cancer, the third most common type of cancer affecting both men and women globally. Unfortunately, colorectal cancer often develops silently, showing no symptoms until it has reached an advanced stage. Other red flags may include unexplained weight loss, persistent abdominal pain, cramps, bloating, or fatigue. If you experience any of these symptoms, especially if they persist for more than 2 weeks, it's crucial to consult a healthcare provider. Your digestive system is a vital part of your overall health, and ignoring its signals can lead to serious consequences. Always listen when your body speaks. It could save your life.